I'm Chris Rorick. I handle the Congressman's legislative issues regarding health care. So thanks for coming in today. What can we help you with?
Nice to meet you.
Good to meet
I'm
you.
Danielle Perret. I am a physiatrist, a physician that specializes in physical medicine and rehabilitation. I work at the University of California, Irvine in Southern California, and I've been there for about 10 years. I'm here today to talk to you about physiatry, and in particular, advocacy and graduate medical education.
Okay.
So I'd like to start off by telling you what a physiatrist is.
That's good because
you probably don't know.
know. Thank you.
So a physiatrist is a physician that specializes in the care of patients with chronic disabling conditions. A physiatrist trains in physical medicine and rehabilitation, and that's after 4 years of medical school. That specialty training is an additional 4 years of residency in a graduate medical education program. And actually some physiatrists after residency also do a fellowship, an extra year or two of training in brain injury medicine or spinal cord injury medicine or pain management, for example. So there's multiple different pathways to get trained.
Is there a specific setting that you work in?
Good question. Physiatrists work in many healthcare settings. That's one of the great points about our field. We provide care to patients in acute care settings, in inpatient acute rehabilitation hospital settings, in subacute rehabilitation settings, and many of us work in ambulatory, outpatient, office-based settings as well, and even in home health type of settings. So along a real broad continuum of care for patients.
Excellent. Great. So are you here today representing your institution, or are you here with a professional society?
Well, I certainly always represent my institution, but I'm actually here representing the Association of Academic Physiatrists, sometimes called the AAP. We are a group of physiatrists or physicians that specialize in physical medicine and rehabilitation that all work in academic institutions in the United States. So we are on a mission to promote more education, research, mentorship, career building, and community service. Our goal is to create the future of academic physiatry.
Great. Now, GME, I suspect, is something you rely on. So.
Absolutely. I'm very passionate about it. We would like to draw some attention to the IOM report that came out just a couple of years ago now. And we recognize, most physicians in every field of medicine, that the current model of GME funding is likely not to be sustainable in the future. Right. And this is relevant as we talk about healthcare reform as well.
Right.
Two of the interesting things that the IOM report pointed out is that in order to reform GME, not only do we need to talk about money, but we also need to think about and talk about providing care in more team-based settings and training our residents, the future physicians of this country, to be able to provide patient care in a broad diversity of healthcare settings. If you look at how GME is funded, it's been funded the same way for many, many decades. It's been funded, and that funding has been tied to inpatient beds, patient care in an inpatient setting only. So we have been training our residents the same way since about 1983. That might have been great in the 80s and 90s, but now we're looking to train innovative physicians that can provide competent health care for patients with different needs than we had in 1983. We want to train the future physician that's going to provide care for the more than 20% of patients in this country with chronic disability. So we need to be training in other healthcare settings.
I think that makes sense. As you know, a lot of us in healthcare policy are looking to get patients out of the hospital and looking for patients to be treated in all different sorts of settings and not relying on the hospital setting. So I think it makes sense to train our physicians outside of the hospital setting as well. So it's a valuable recommendation. Thank you.
You're welcome. One of the other unique things that may be interesting to you is physiatrists provide a lot of care to patients not only with chronic disability but with chronic pain needs. I know almost half of the country has chronic pain needs right now. It's an enormous population of Americans. I think 116 million Americans last time I checked, and everyone is drawing so much attention to the opioid epidemic for appropriate reasons. It really takes a lot of finesse and training to know when not to overprescribe and when not to underprescribe, and how appropriately to manage all these patients with chronic pain needs. I think we are a great resource for this country. We are one of the fields of medicine that is able and trained to provide really holistic care, and I mean not just pharmacologic care for patients with pain needs. We use a lot of different modalities, musculoskeletal-based therapy programs that we prescribe, and we manage the patients really holistically. So I think we could be a great resource trying to get out of the opioid epidemic.
That's great, thank you. Well, as I'm sure you're aware, Congress is looking to revise GME. It's on the horizon. It's on sort of our to-do list, so to speak, and we all know that we could use more GME funding. That's a question or something that everyone comes in here asking for more money for GME, but I really appreciate your perspective about how to reform the system, and delinking it from the acute care setting I think is valuable input from us, because we haven't heard a lot of that. We need to hear recommendations that are outside of the funding stream, because we all recognize funding is needed, additional slots are needed, but reforming the system I think is something my boss is interested in, so thank you for that recommendation.
You're welcome. I think another thing to think about is being ethical and equitable toward the patients with disability needs, because they may be disparate geographically. So it may be good to consider increasing funding, especially with attention to eliminating geographic disparities in care. We have a lot of states where we don't train any physiatrists, and those states tend to have high populations of persons with chronic disability.
Right.
So we are one of the unique fields that has some overlap with other fields, but provides very unique care. And there are so many Americans that could benefit as we all age, as we all have pain needs, and as we all, many of us, become disabled in some way.
So we really appreciate you coming in today. Thank you for coming.
Chris, I want to thank you. I know how busy you guys are. I do want to leave you with a packet of information that details a little bit more about physiatry, about the Association of Academic Physiatrists, and about what our mission is pertinent to graduate medical education. If you ever have any questions, please feel free to reach out to me. I'd love to have more dialogue with you.
That would be great. Thanks so much.
You're welcome.